get us started. So this webinar today is co-sponsored by NGA and APHSA and is going to feature speakers from ASPE at the Department of Health and Human Services, and we're going to be discussing what happens after CARES, projections of poverty and program eligibility from the COVID-19 pandemic and economic recession. So I think we're probably all overly familiar with Zoom at this point, but just to do a little bit of housekeeping, please make sure that you are muted unless you're speaking during the Q&A, and the host will be muting anybody whose mic is causing feedback since we are recording today. And we will, like I said, have Q&A at the end of the session, so please make sure to drop your questions into the chat as we're going, or to raise your hand, and that's a little icon at the bottom of your participant panel, and I'll call on you and you can verbally ask your question that way as well. So our agenda for today, we will kick off with a welcome from the National Governors Association and a welcome from APHSA. And then we will hand it over to the Office of the Assistant Secretary for Planning and Evaluation, presenters for the main presentation, and then we'll have a couple of minutes for Q&A at the end of the hour for you all to engage and ask questions. So Rosalind, with that, I'm going to hand it over to you for the welcome.
Great, thank you, Christina. So hi everyone, my name is Rosalind Moser. I'm a Senior Policy Analyst for Human Services within NGA's Human Services and Early Care and Education program. For those of you who are not familiar with the National Governors Association, we are the national bipartisan organization of our nation's 55 governors. We were founded in 1908 and are currently led by our chair, Governor Cuomo of New York, and our co-chair, Governor Hutchinson of Arkansas. I sit within the Center for Best Practices, which is the think tank / consultancy arm of the National Governors Association. We are divided into 13 different policy areas, which you can see on the right-hand side of your screen. I just wanted to point out really quickly, nga.org/coronavirus, our teams across the center have been tracking gubernatorial actions across a multiple areas of policy throughout the coronavirus pandemic. And so all of those resources are available on our website there. I'm really excited to join this really important conversation, and I'm happy to welcome all of the governor's offices to the call today. Thanks.
Thank you very much for that. And I'll provide a brief overview of the American Public Human Services Association and just welcome you again to the webinar. So if you're not familiar with us, we are the bipartisan nonprofit membership association for health and human services agencies across the country. So our members include state and county Health and Human Services secretaries and commissioners. It includes TANF, SNAP, child welfare, child care, many of the other programs that represent sort of the constellation of health and human services. So what we do and what we aim to do with these members and with other stakeholders is really to influence policy and practice. It's to build knowledge and capacity in the field. And it's to connect members and partners with each other during conversations such as the one today that we're having. So with that, I'm going to hand it over to our presenters. Again, we're going to be hearing from Robin Gertner, who is the Director of the Division of Data and Technical Analysis at ASPE, which is within the U.S. Department of Health and Human Services. And we'll also hear from Suzanne McCartney, who is a Social Science Analyst at the at ASPE as well. So with that, Robin, I am going to stop sharing my screen, and I believe you're going to start sharing yours.
You got it. Let's see. Okay. Hopefully this works.
Yep, you're all set.
All right. Okay. Thank you so much, everyone. Thanks for joining us. We're really excited to present this work. Big thanks to both APHSA and NGA for inviting us to present. This is work that we're really excited to share, and it's very prescient, very time sensitive, and also if legislation is passed, maybe this work is no longer needed. We are happy to share it with you all. Suzanne and I work in the Office of the Assistant Secretary for Planning and Evaluation, which is the policy office or the policy think tank within HHS. At the federal level, our mission is to provide expert research insights, analysis, and consultation to the Secretary of HHS, as well as other leadership across the board within HHS and the federal government. So today, Suzanne and I are going to be presenting our projections on poverty and program indicators for the remainder of the calendar year, starting in August, and some other contextual factors that we think are critical for health and human services agencies across the country to be considering. We have a big team that's worked on the analysis. You can see their names there. I want to make sure that they get the credit they deserve, but you will only have to suffer through Suzanne and I in speaking, or at least through me. You won't have to suffer through Suzanne. She's a great presenter. So the first thing I want to talk about, I'm going to give some background about what we're doing, and I'm going to give some background in the labor market context, and then I'm going to turn it over to Suzanne, who is going to talk you through what our projections actually are. So the first question I want to raise is, why are we doing projections? And the answer to this is simple. You all need timely information on poverty, program eligibility for your budgeting, planning, and any policy development. But as you are probably aware, national data on these factors is incredibly lagged. Census Bureau will soon, in September, be releasing poverty rates, but those poverty rates will be for 2019, which obviously 2019 was a boom, a growing economy, and 2020 is not. So getting the poverty rate for 2019 won't help you too much. This is why we kind of have to project forward in terms of what we think poverty will actually be by the end of the year. So how do we do this? Really quick, we use simulations. So we simulate what we think the economy looks like now and what it will look like, what demographics of our country will look like, and all this influences program eligibility, program participation, income, etc. We create 3 scenarios of what the economy could look like for the remainder of their calendar year. And it's mostly driven by what we project will happen with unemployment. So we create 3 scenarios, a low, medium, high. Low unemployment, we're assuming an 8% unemployment rate for the rest of the year. Medium, it's 10%. And our high scenario is 11.8%. It's 11.8 because that's just how the cookie crumbled. We had to build it from we build our simulation model from the bottom up, making assumptions about what unemployment looks like among certain types of workers and demographic groups. So keep in mind, these are not what the unemployment is. It's what we are projecting it to be. So that's important to think about. So projections, what we're going to be presenting in terms of our projections, this is not what is happening in the country, and it's not even necessarily what will happen, but what could happen if the various parameters in our scenarios come about. Now, that's not likely that we hit it 100%, but it gives you an idea about if this is where the economy goes, this is what you will see in your states. So our results depend on those assumptions that we make, chief among them what happens with unemployment and unemployment insurance. I do want to give a shout out also to the Urban Institute, who conducted this work with us. They've been a really steadfast team doing a lot of great work on this at a really fast pace. Just a couple other assumptions I won't go into detail, but as many of you know and understand very well, the CARES Act made a number of changes that influenced people's economic well-being, particularly through unemployment insurance, SNAP, and the economic impact payments. Here are just some of the basic assumptions that we make, that 80% of any of wage earners that are eligible for a UI take it, 55% of the self-employed who are eligible take it. We include all the changes to unemployment insurance rules and benefits, as well as to SNAP, and we assume that everyone who's eligible for the stimulus checks gets them. So I'm going to jump into some economic trends. Much of this you may be aware of, but I think it's important to kind of put it all in one place to provide some context for the projection. So first, I'm going to talk through the unemployment rates in the country, and I think you are probably all very intimately familiar, probably too familiar for our own mental well-being, with what these unemployment trends look like. And as you could see, prior to the pandemic, our country had a very strong growing economy. Unemployment rates were generally drifting downwards. The pandemic brought the economy to a standstill. The peak in unemployment was 14.7% in April, which translates to about 23.1 million people who want to work but are out of work. Since then, we've seen a 4.5 percentage point decrease in unemployment to the rate in July that was reported of about 10.2%. That's about 16 million workers not working. This downward trend, happily, is across all race, ethnic groups and age groups, although we do see some disparities across them. You can see here that the Black and Hispanic unemployment rates are much higher than the white and Asian rate. I'm going to change slides here. You can see this is by age. You can see youth unemployment, so 16 to 24-year-olds. Their unemployment, while also historically higher than other age groups, peaked much higher and has remained steadily high, higher than other groups. Now, one factor that's important to consider with these declining unemployment rates, we often ask ourselves the question, is this because people are dropping out of the labor force or more people are working? And actually, we are seeing the latter. We are seeing increases in both employment and labor force participation in recent months. So the reduction in unemployment rate is not simply due to people giving up and dropping out of the labor force. This slide here looks at reasons for being out of work. The data go up through the latter part of July, so not taking account of what's happened in August. But as you can see here, the red pinkish sections of the bars here, these are COVID-related reasons for not working, for being unemployed. And what stands out here again is the story on youth. Youth are much more likely to not be working for reasons related to the pandemic. So the top bar there is for youth age 18 to 24. 19% of youth are unemployed because they lost a job related for some COVID reason, which could be the job closed, many different reasons. And then 9% are unemployed for other COVID-related reasons. So this could be they got sick themselves, or caring for someone that's sick, or maybe they're nervous about going to work because of context, they could be at high risk. So this slide here is interesting. This tells us a little about helps us think about future expectations for work. It's helpful to know how many people are not working specifically because of the pandemic, right? So this gets into that in a little different angle than the last slide. Here we're looking at among the unemployed, those that are unemployed because of temporary layoff, right? So most unemployed persons now are unemployed because of temporary layoff. And if you look at this historically, back about a year ago, most people that were unemployed were unemployed and fully laid off rather than temporary laid off. So they weren't necessarily expecting to go back to their former job. What you see is at the onset of the pandemic, a dramatic shift here. In April, fully 78% of those unemployed were on temporary layoff. As you can see, those numbers are declining, which means more people have been kind of pulled back to their jobs as the economy has been improving. What's not shown here is that data from the census suggests that between 15 and 25% of working age adults are not working for pandemic-related reasons, which is around what we showed in the prior slide. And then the last economic slide here I want to show you looks at the labor force in a slightly different way. So here we are looking at two groups of individuals who are not working and who are not actively looking for work. So this is what we classify as people that are not in the labor force. So on the left, this chart looks at the marginally attached individuals. So these are people, excuse me, these are people who want and are available to work, but they have given up looking for a job in the last 4 weeks. That's what the survey, when people are asked about their employment status, they're asked about what they've done in the last 4 weeks. So these are people that have not been looking for a job, but they would like to. Okay, so what you see here on that left chart, the marginally attached, just like with unemployment, we see this big spike between February, March, and April. Since June to July, those numbers have decreased, which is great news. To the right, this is discouraged workers. So this is a subset of the marginally attached. These are workers who are looking for work specifically because they don't think there are any jobs available to them, hence they are called discouraged. So the numbers for both these groups steadily increased. The recent decline in the marginally attached suggests this trend is reversing. Though the number of discouraged workers has leveled off, this could be, people could be discouraged because they're nervous, they don't have childcare maybe, or there are health concerns, either they are sick or they feel that they're high risk, or they're caring for someone who's high risk of the infection from the virus. Here I want to show you an aspect that I know that many of you have been thinking hard about, and this is the trends in the child care industry. And the child care industry is important to think about for a lot of reasons. Many of us, myself included, rely on the child care industry to allow us to work. And so this is one of the big barriers that we see for people to go back to work and for businesses to restart and things. And so if you look at this, is a long-term trajectory since about 2000. Okay. Employment in childcare industry has been growing very rapidly, particularly in the last 5 years. When the pandemic hit, employment in that sector dropped by about a third, and this is a drop bigger than any other sector outside of hospitality and leisure, like restaurants, hotels, and resorts. Other than that industry, childcare got hit the hardest. Since April, it's been coming back. We are at about 820,000 workers in that industry are now working as of July, of course. So we have seen that industry coming back, still not quite at the level that we saw prior to the pandemic. And here I want to take one look at 2 indicators of economic well-being. We've been looking at unemployment and work. Here are 2 other factors that are critical for our consideration here for the context of the pandemic we're facing. The one on the left is an indicator on housing, and the one on the right is on food security or food sufficiency. And as you can see on the left, the last measure that we have was from 2017. 7% of renters in the country in 2017 were not paying rent on time. That number ballooned to 29% of households with children couldn't pay rent on time, and 16% of households without children couldn't pay rent on time during the middle of July. On the right, we see indicators of food sufficiency. So this is answering to the question, the food we bought just didn't last and we didn't have money to get more. It's kind of like, how much food, do you have enough money for food? And so here we see the last measure of this was in December 2018, and only 6% of the population were in this situation. Fast forward to July, and 42% of households with less than $30,000 annual income were facing food insufficiency. All households with children, that number was 31%. And as you can see, Blacks and Hispanics far outstrip whites on both of these measures. And the last slide I'm going to share before passing the mic to Suzanne. This is a related indicator. This looks at child maltreatment. We've been mostly talking about economic circumstances, but I think many of you also will recognize that child well-being is closely tied to economic circumstances, and many of your agencies or departments you may be working with look at both employment situations and also child welfare, child maltreatment. So here's an interesting slide. This looks at indicators of child maltreatment reporting that states have been receiving. And so these numbers here reflect differences from 2019. So if we focus on the blue line, this is reported incidents of child maltreatment. So calls to Child Protective Services for child abuse and neglect. In April, they were down 45% from the year prior. In May, down 36%. So for those two critical months in April and May, Child Protective Service agencies in these 6 states here that we have data from, we're seeing dramatic reductions in the number of calls that they were receiving. Those reductions have, sounds like a double negative, those reductions have decreased. So as we've gotten into June and July, the numbers have leveled out to what they were a year ago, which is good news. But the challenge here in interpreting the data are that most reports come from schools and childcare, and because those are out over the summer, every year we see a decline in reporting over the summer automatically. So it's not surprising, just understanding the cyclical nature of child maltreatment reporting, that the numbers would start to converge. It could be that once school starts again, in many states, schools have already started. So once we get numbers for August and September, we may see a reporting decline again. So I'm gonna pass the control here to Suzanne. Suzanne, have at it.
Thank you, Robin. So we'll turn now to poverty projections. First, I'll just say, yes, thanks, Robin. Looking at these, this next figure, we're showing here the annual poverty rate. And if you start on the left, here we're saying our benchmark for what poverty is right now. The most recent data published says that the poverty rate for 2018 is 11.8%. And what we do in this simulation is estimate the impact of the CARES Act, including its economic stimulus payments and the broadened benefits of UI. So particularly when these are included as income, the center bar shows we project that the poverty rate will be 11% for 2020. This is a little bit counterintuitive, given the recession, given the high levels of unemployment. We might expect that the poverty rate, when we do see it later, would have increased. But in fact, due to the CARES Act, we're estimating that poverty would have decreased by about 0.8%. So just looking at the first 2 bars, what this shows is that the CARES Act replaced lost income and kept poverty from rising. And we believe potentially the largest impact were stimulus payments. These were received by many more people than just those who are unemployed. And when we compare that to the last bar, this shows what happens when we're just focusing on the last 5 months of 2020. These months begin after the CARES Act expires or has expired July 31st. So without these added benefits, we project that the poverty rate for just this period, August to December, poverty is expected to increase by about 3 percentage points if we're looking at it under our mid-level unemployment scenario. If you go to the next slide, I'll explain a little bit what that means. Thanks. I think this we might have this out of order. So what we're doing again in this scenario is we are projecting what poverty is once the CARES Act expires. And to do that, we considered 3 unemployment scenarios. We have a lower unemployment scenario, about 8.5%. Our mid-level unemployment scenario is 10%, which is about what the unemployment rate is for July, when the new numbers came out. Our higher unemployment rate is 11.8% in the scenario. So we have these 3 scenarios, and if you look on the left, what this means is our lower unemployment rate projects poverty will be 13.6% in the months ahead. Under our mid-level unemployment rate, we are projecting poverty will be 14.0%. And it would creep up a bit if unemployment was higher. On the right, what this translates into is the number of persons in poverty. So if you just look at the middle bar, that's our mid-level unemployment rate. Compared to our baseline, this is an increase of 7 million more persons in poverty in the last 5 months of the year. The poverty rate, it's a small increase of 2 percentage points, but in terms of millions of people, it's quite an increase. So we are projecting with the expiration of the CARES Act, about 7 million more persons will be in poverty, and that's plus or minus about 1.7 million, depending on whether the unemployment rate declines a bit or increases a bit. So on the previous slide, this looks at the impact of the recession on these different groups. And this focuses on the positive impacts of the CARES Act. So this slide shows the impact of CARES by race and Hispanic origin. And for context, we know that in the figures that Robin has already shared, the recession has played out unevenly across groups. We know, according to recent Bureau of Labor Statistics numbers, that returns to employment have happened more slowly for the Black unemployed. And our simulation is consistent with these employment patterns. So what this figure does is boil down these facts to say the CARES Act is important for many individuals and families across groups. And this is particularly true for the Black population. So if we look at annual poverty, that's what this shows. The overall poverty decline from the CARES Act is just under 1%. It shows a 0.8% decline in the first bars on the left. And it's the same level of decline among Hispanics, 0.8%. But among Black individuals, CARES is estimated to have reduced the annual poverty rate by 2.2 percentage points. So, we share this slide just to zero in on this differential impact among the groups, and then to also highlight, as CARES expires, this group is projected to be hit harder than others by the expiration of the CARES Act in the months ahead. And again, this is under our mid-level unemployment scenario. So if we could just go back. Oh, thanks, Robin, that's the one. So looking in the months ahead, now we're projecting what poverty will look like, not annually, but in the period August to December. So this slide shows what we project poverty will be from August to December across age groups and for men and for women. If unemployment stays in the middle range, we project that poverty will increase 2 percentage points overall, and children are disproportionately impacted by this. Their poverty rate is projected to increase about 4 percentage points. Otherwise, the impact is projected to be spread fairly evenly across working age groups and for men and for women. Although you can see here that those ages 65 and over, they don't really show any impact in our model for this recession. So moving on to the next slide. Again, this is the same period in our mid-level unemployment scenario for the months ahead. We look at race and ethnicity. So this increase is about the same for white, non-Hispanic, and also for Black, about 2 percentage points. And what's notable in this slide is that the starting point for the groups on the right is considerably higher. Prior to the recession, the Black poverty rate for 2018 was 21%, and the Hispanic rate was 18%. Even so, the Hispanic group is projected to be hit disproportionately by the recession, with a 3% increase in poverty in the months ahead compared to a 2% increase for most other groups. And these same two groups, Black, non-Hispanic, and the Hispanic group, are also those groups who are hardest hit by the pandemic, by COVID-19. So we wanted to highlight this, again, a disproportionate impact of the expiration of the CARES Act in the months ahead for these groups in particular. So the next slide, our next couple of slides looks at our programs that reach out to these groups as poverty is projected to increase. We are going to look at TANF and also SNAP benefits. These numbers come from our same simulation that looks at the months August to December for 2020. And the scenario that we're sharing here is our middle range unemployment scenario. So what this shows is that we project eligibility for TANF to increase by about 925,000 persons in the months ahead, a little under 1 million. If the unemployment rate is a little lower, it's about 8.5%, that number would be closer to 700,000. On the higher end for TANF, if unemployment goes up another percentage point or 2 percentage points, we are projecting that TANF eligibles could increase by 1.1 million persons. So again, these are persons who are eligible for the program, and as a comparison, if you just look to the left side of the figure, we show these are TANF recipients. And TANF recipients from 2018 to about this time in 2019, the range is about 2 million to 2.2 million. So relative to the size of folks participating in the program, eligibility, is considerably, larger, about 4 times that. So something to keep in mind, we are sharing projected eligibles. The numbers will seem large compared to the actual number of persons who currently participate in the program. Looking at new TANF eligibles across groups, this slide shows who we expect to be newly eligible for the August to December period in our mid-level unemployment scenario. And overall, on a percentage basis, we expect the number of eligibles to increase by 8 percentage points. And that plays out within range for white and Hispanic groups, 9 to 11 percentage point increase. We do see the increase for Black non-Hispanic persons to be about half that. and we are looking into this difference. We think there's a couple factors involved here. It's not any one factor that we could identify right away. So this is something that we're looking into, but the overall increase, again, is about 8%. And now if we turn to increased eligibility for SNAP benefits, these large bars on the right, again, we're focused on SNAP eligibles. So for our August to December scenario, we're looking at an increase in SNAP eligibles by 9.7 million. And it could be $1 million less than that. It could be 2 million more than that, depending on the level of unemployment that we plugged into our model. So this is quite an increase, and for that reason, we also wanted to share the number of TANF recipients, and that's on the left side. So on the left, we have numbers that come from the USDA. These are their published estimates. They did show an increase in the number of persons participating in TANF from March of this year to April of this year. The increase was 5.9 million new participants in the program. So our numbers really start with a lower baseline compared to last year's numbers. We are estimating these, additional 8 to 12 million more eligibles, and we wanted to just keep that number in mind with the overall TANF caseload rate, which is increased from about 39 million to about 43 million earlier in 2020. If we look at the same increase in eligibles for SNAP across the groups, overall, we see a percentage point increase in SNAP projected for the months ahead to be about 13%. And it's not too far. It's about 10 to 11% among children for Black non-Hispanic and for the Hispanic group. But among white non-Hispanics, the increase is expected to be a little bit larger at 16%. So just like with TANF, we've looked into this to this difference, and there's a few factors to consider. What we're looking at in the data is just that this is largely an effect of income. There is more of this group of white non-Hispanics whose income is closer to the line of eligibility for SNAP, a little above the line, a little below the line. So this recession impact, as far as SNAP eligibility, is projected to show up a bit more here for white non-Hispanics. And next, we just wanted to share something from our, we're looking at child support. We're working with the Administration for Children and Families, and we wanted to get a better sense of what to expect in terms of child support collections for 2020. And just like with the poverty rate, where we might expect the rate to jump a lot for poverty, and we might expect child support collections to decline considerably. What we estimate, partly based on our model and partly based on some out-of-model adjustments from the Office of Child Support Enforcement, is that compared to 2017, we are expecting 2020 child support collections to increase by about $4 billion. And that is largely because of unemployment insurance. These estimates are largely based on withholding from unemployment insurance. So the number is a little bit sensitive to who applies for and gets access to unemployment in reality compared to who we, expect to be able to apply and access the benefit. So, if 80% of people get the UI benefit that they are eligible for, we expect this considerable increase in child support collections. A technical note on this, this does not include any collections from economic impact payments. The economic stimulus did not factor into our estimates here, and that's largely because as a stimulus, it's a tax credit, and those are deemed for child support arrears rather than care and support. So let me turn it back to Robin to move forward with Medicaid.
Great, thanks, Suzanne. So I'm going to mirror what Suzanne just presented for SNAP and TANF and talk about Medicaid quickly, as fast as you can talk about Medicaid, an incredibly complicated program. So these are our projections for eligibility for Medicaid. If I can first call your attention to the inset box on the left, what we're seeing from February, right before the pandemic, to May, total enrollment in Medicaid and CHIP rose by 2.3 million, a dramatic increase, one of the sharpest increases in recent history. So that's a little bit of the context for the increases that we're seeing also in our projections for the rest of the year. So the big chart on the right, the blue bar shows what we estimate eligibility to be at the last point in time that we have numbers for. And then on the right is what we are projecting eligibility to have increased by the end of the year. So we are projecting eligibility to have increased by between 6.7 and 6.9 million people. So almost 7 more million people will be eligible for Medicaid and CHIP by the end of the year than what we saw at the start prior to the pandemic. If we look here across demographic groups, similar to what Suzanne showed before, this is our mid-level scenario. We are projecting that the largest increases are among the white non-Hispanic population, 9.7% increase in eligibility among white non-Hispanics. When we look at Hispanics and Blacks, their eligibility for Medicaid also increases, but by not as high. This is a really confusing chart, but this is confusing because I want to show you that where other estimates are on Medicaid eligibility and enrollment. Now, as Suzanne pointed out, for SNAP and TANF, just like for those two with Medicaid, our estimates, our projections are for eligibility, not actual enrollment. So we wanted to show you some estimates of enrollment that other organizations have put out. And they've been all over the map because of different assumptions about what the unemployment rate will look like. But I think if you look at this, you can kind of get a sense on the bottom of this, the x-axis on this chart. This is what unemployment rate projection would be. And the height of these dots is what the number of enrollees, the increase in enrollees would look like at that given unemployment rate. So you can see that the dots are kind of increasing height as unemployment goes up. So there's a general tendency here to say as unemployment goes up, the number of new enrollees in Medicaid will go up, which is what we would expect. And if you think about where we are right now, we're at about, in July, we're at about 10% unemployment. So at that rate, we're projecting around nearly 7 million new enrollees, new eligibles. That's what our estimates are saying. Other organizations are projecting anywhere between 4 and 15 million new enrollees, depending on where the economy goes. this is kind of important to think about is in the States, we're already reporting dramatic increases in enrollment, and it's only going to continue through the end of the year as long as we face this historically high unemployment rates. And the last bunch of numbers I'm going to show you, this is just budget projections nationally, based off of those estimates on the last slide. We could be seeing anywhere between 35 and 150 billion more national expenditures on the Medicaid CHIP programs, depending on where the unemployment rate goes. Now, these are all looking at unemployment rates much higher than what we are seeing right now, and what I think most economists now would project through the rest of the year. So these numbers are probably all on the high side, but it's context to think about. So I'm going to wrap it up there. We threw a lot of numbers at you, so I hope you were ready for that. I'm going to talk just at a high level kind of what some of the implications are to pull away, but I know that Christine is planning on having a robust discussion here. There's a lot to talk about. Some of the key implications here, I think, that hopefully stand out: the federal stimulus that came through the CARES Act and other measures has played a major role in mitigating the impact of the recession. However, as those benefits expire, we are expecting more families to enter into poverty. Program eligibility, we're also expecting to increase for some programs fairly dramatically, which all suggests the need or demand for more economic support that families will be facing through the remainder of the year. We've also tried to point out the differential impact of the recession on different populations and the potential increases that we will see in program eligibility and poverty. We saw that youth and Blacks are facing the highest unemployment rates and some of the highest poverty projections. And Suzanne had mentioned this, that many of you may be aware of the racial disparities in terms of the prevalence and treatment availability related to COVID-19. And this just adds complexity to both we're seeing barriers in terms of getting access to treatment for COVID among the same populations that may be most impacted by the recession. I just want to say one last thing before passing it to Christina. You notice we've, in terms of our race ethnic breakdowns, we focus exclusively on white, Black, and Hispanic. This is not because we don't care about the other populations, about Asian, American Indian, Alaskan Native, etc. These are modeling limitations. We don't have sufficient sample size to accurately project for those specific populations, but our overall estimates do include the whole population of the U.S. So I know that that's a glaring omission, but it's unfortunate that we don't have the methodological strength to do that.
All right. Well, thank you so much, Robin and Suzanne. That was wonderful. And I apologize to the audience. It was a rookie mistake of me not to mention that we are going to be sharing the slides with you all. Everybody who registered will be getting a slide deck in the next day or two. So my apologies for any confusion there. But I've got a couple of questions starting in the chat. So I'll start us off there, and then I'll ask folks on the phone or in the Zoom room if they want to unmute themselves. So just mentally prepare yourself for that. But like I said, I'll start in the chat. So Robin, when you were on around slide 27, and the increase of Medicaid, there was a question around whether that increase is more, whether that increase is more because of new legislation preventing Medicaid and CHIP from ending, not necessarily new enters.
Right. That's a good question, and I'm not sure we have a direct answer to that. I don't think we could. So one thing to keep in mind, what we have here are, we are projecting eligibility, not actual enrollment. So eligibility doesn't really take into consideration whether states are restricted from ending people's Medicaid. So our estimates are exclusively how many people are eligible. So unfortunately, I'm not really in the position. I don't really know to the extent to which increases in enrollment here on the left, this increase between February and May. I don't know the answer to that question. That's a great question and something I think is definitely worth looking into.
Perfect. And then another question is, are there any predictions on what the uninsured rate could look like, as we know many individuals are delaying seeking coverage due to other more immediate needs like food and housing?
So we have not projected that, but I know that other organizations have. I don't have here off the top of my head, but I know that you can find projections on increases in the uninsured rate, and they're, I don't remember the numbers off the top of my head, but they have seen increases. I think maybe like Families USA or another organization has made estimates around that.
Okay. All right, thank you, Robin. So again, I know a couple of folks are on the phone or in the Zoom room. Does anybody want to unmute themselves and ask a question?
Hi, everyone. This is Augustine from Maryland. I'm curious as to whether any of the economic stats you presented take into account the gig economy and the impact, COVID-19. I guess what post COVID-19 look like for that particular industry.
Yeah, that's a great question. And we have been trying to monitor some of the trends in people shifting job sectors. These projections on poverty that Suzanne was talking through, we did incorporate eligibility for unemployment insurance among the self-employed and gig workers, which is, you're probably aware that one of the major changes to the CARES Act was allowing unemployment insurance for gig workers and self-employed where previously they were not eligible. So we have done our best to incorporate that into what we're projecting poverty rates and program eligibility to look like. So that's incorporated there. Yeah, unfortunately, I don't have any trends in our employment stats to consider people shifting, what that shift is from maybe wage worker to gig worker.
Yeah, thank you. I was just curious about that because, with so many people working remotely, I anticipate, the return to normalcy for that particular industry is going to be much slower as, many more businesses opt to have their staff work from home.
Yeah, for sure. And I think, I think this chart here, I think is telling, so this chart here is very much telling in terms of thinking about that initial, if you look at that April bar, that initial spike, let's see if I can combine these two charts in a way that makes sense. So here we see this huge spike in unemployment. The dashed black line is the overall unemployment from March to April. That was the biggest period of spike. And in April, that spike is in large part due to these temporary layoffs. So this would be not the gig workers, but people, working for wages in a factory, in a restaurant, wherever, those temporary layoffs are starting to decline among the share of unemployed. Those on temporary layoff are likely the one, or those on permanent layoff are likely the ones that are continuing to suffer. And this term layoff doesn't only include, I think that also would include gig workers, could be classified that way. So I think from that perspective, this data is kind of telling that story that you're talking about.
Yeah, thank you.
Great. And one last call for questions from the phone or in the Zoom room. Otherwise, I've got one more in the chat too.
Hi, this is Jamila. I'm hoping you guys can hear me okay. I did have one question about whether any of your predictions were able to see any differences across states, whether that's different regions, southern states versus states of the west or the east, or even across kind of the different red, blue, purple states. Would love to know if you saw any states that might be predicted to do better off.
Go ahead, Suzanne.
I can answer that, Robin, if you'd like, which is this model right now is based on national data. It's from the Current Population Survey, March Social and Economic Supplement. So we don't parse this out by state in this analysis. What we are working on right now and hope to share, in the next couple months is exactly what you just asked about, which is, more state level focus or regional focus. But for this data, it's really not equipped to, be parsed out by state. But that is something that we're working on.
Awesome.
Thank you.
Sounds like another webinar in the making. I love it. Okay. So
and real quick, on chart 15, there was 11.8% unemployment rate for 2021. I take it that should be 2020?
Yes, that's a typo. Thank you.
Thanks.
Thank you.
Right. Love that. Okay, so I think we've got time for one more question. So let's go back into Medicaid. How should states interpret the projected Medicaid eligibility increases given the status of Medicaid expansion in their state?
Yeah, that's a great question. And we've had a couple states jump into that too, right? So, our modeling takes into consideration all the complex rules that each state has in terms of eligibility for Medicaid. So this already kind of builds into the reality of which states are expansion states and which aren't. So this national estimate would incorporate that. Now, I would point you to I see the sources aren't on here. What I'll make sure we do, Christina, when you send the slide deck around, I'll make sure I put the sources for here. These different sources, some of them do break out enrollment projections, eligibility and enrollment projections between expansion and non-expansion states. I do think that if for states that are the non-expansion states that may be considering expansion now, you would certainly, the way this would translate to your state obviously would be dramatically different in terms of what the actual increase that you may see.
Okay, all right. Well, we're right at the top of the hour, so that was timed perfectly. Suzanne, Robin, Rosalind, thank you all so much for jumping on today. I think this was wonderful. Like I said, if you've registered and if I have your email address, you will be getting the updated PowerPoint that we're sending out with all typos fixed. And otherwise, you'll continue to hear from us, and we'll follow up with additional information. But thank you all so much for jumping on today, and we'll be in touch with more soon. Bye.
Thanks, everyone.
Thank you. Bye.